Yeah.
Would you please introduce yourself, doctor?
Yeah, I'm Professor Dr. Desarda, and I have invented a new operation technique for inguinal hernias that does not require mesh. It is followed all over the world as Desarda Technique for inguinal hernias.
Thank you, doctor. What are the things that a person who has been diagnosed with a hernia should realize and understand before he proceeds with surgery?
Yeah, the first thing is, you should know how to diagnose hernia yourself. It's extremely simple. Need not go to any doctor or need not get your sonography done also. If you stand up and when you cough, and if you find that swelling appears in your groin, small swelling or big swelling appears in the groin and disappears when you lie down, then it is hernia. If it is in the groin, it is groin hernia. If it is in the umbilicus, it is umbilical hernia. It is very simple to diagnose. It doesn't get reduced automatically in lying down position in later stages of hernia if the hernia is obstructed. Understand?
Understand.
Right. Secondly, naturally question comes, sir, why hernia took place? Yeah, till today it was taught or it was described in books also that weightlifting, coughing, etc. causes hernia formation. We have stated and published new theories and we have said that these are not the real factors that cause hernia formation. Because if it was so, then every asthmatic patient should have developed hernia. Every coolie on railway platform should have developed hernia. So it means these are not the real factors. And then we postulated new theory. It's very simple to understand. You see, our abdomen is covered by three muscles. And they are just in front of each other like this. And they give protection during every action against the intra-abdominal blows like cough, etc. Now, these three muscles, they are called as external oblique, internal oblique and transversus abdominis. These three muscles, they start from the chest cage and go to the groin to get inserted. And from there, thigh muscle, they start. Here at the end of the muscle, one structure from the abdomen comes out that is called a spermatic cord. Comes out from the abdomen like this, turns like this for 1 or 2 inches and then descends into the scrotum to supply to the testes. This spermatic cord is a very complex structure and very important structure because your testes life depends on that. Naturally your fertility or genital life also depends on that. So this structure is very important. This spermatic cord is in between front one muscle and behind two muscles. It crosses in between. Our theory is that those two muscles which lie behind the spermatic cord, they are either absent or deficient in their lowermost part. In their lowermost part. So naturally what happens? It has become a weak spot. So every action, eating, walking, coughing, running, everything raises your intra-abdominal pressure to some extent, and that is normally counteracted by all three muscles together. This we don't realize. This is a minute to minute, second to second process going on throughout the life. Now here, because in lowermost part the muscle is absent, it has become a weak spot. So naturally every thrust from inside will push this bag or peritoneal sac in which intestines are kept outside. And another balloon forms to this peritoneal sac, that is hernia, that is called as hernia sac. Now it should have come out directly through outside. But since there is front one muscle which is a very strong muscle, it doesn't allow it to come directly outside. So it follows the course of the spermatic cord. And then slowly and gradually it becomes bigger and bigger and reaches up to the scrotum to become inguinoscrotal hernia. So understand, our theory is that these muscles in the lowermost part of this behind two muscles, if they are absent and deficient, then only hernia formation takes place, otherwise not. It is nothing to do with your lifestyle, weightlifting or running or sports, everything, nothing. All those other factors described are just aggravating factors and not the real factors that causes hernia formation. Now, if this defect had been 80%, then that person would have developed hernia in the childhood itself. But if it is only 10-20%, then slowly and gradually develops in later period of life depending on your, again, then lifestyle. So hernia formation takes place. It's nothing to do with your lifestyle. It is not your fault at all. It is genetically transferred. So hernia is commonly seen in families. But it is not a must that if father gets hernia, child will get hernia. Because this is a weak trait. It may not be passed to the children. So hernia formation is nothing to do with your lifestyle. What is the treatment?
Yes, doctor. So, if a person has been diagnosed with hernia, what is the treatment? What are the options available? And what are the costs, benefits, risks of each approach?
Yeah, that is a very important question because patient is ultimately interested in getting cured. So naturally he wants to know, sir, what next? We give 6 advices. First, never hernia cannot be cured with medicines. Hernia cannot be cured with yoga or exercise. In fact, it will increase. Hernia cannot be cured with external application like hernia belt. And if you go on following these 3 methods, then you are ultimate loser. You will lose time, you will lose money, and hernia will become bigger and hernia will get complicated. So many times on internet I have seen that somebody is postulating waitful watching, etc. I don't think that this is a correct approach. You can't wait till hernia gets complicated. We advise to get it operated as early as possible. Don't waste your time. As early as possible get it operated, even if it is not painful, from a good doctor. It is likewise your shirt is torn. You don't wait. Then you go to some tailor and get it stitched as early as possible. So go to a good doctor so that he will stitch your hernia in a proper fashion to give you proper cure. So once you know that surgery is the only remedy for this, then you should know little bit more about the operation. Now this operation is very simple. You see, hernia is seen just below the skin. When you cut the skin, you will find hernia. So you have to open up this hernia sac and clear it from surrounding structures from outside, as well as push all those intestinal contents or intestinal curtains which had come into the sac into the abdomen back, and make the sac empty and cut this sac. This is the first part of the operation. Now, once this hernia sac is cut, then your hernia will disappear. But you will not be cured, because the real disease of hernia is not this grown-up sac, but is the hole, that weak spot, because where these muscles are deficient or absent. So you have to plug this hole or hernia weak spot with some structure so that it will give you perfect strength against protection of repeated intra-abdominal blows throughout your lifetime. And if for this I ask you that I will use your t-shirt or your shirt which is prepared from polypropylene or polyester and stitch it over there, is it acceptable to you?
Certainly not.
You will immediately say, sir, how can we stitch a piece of cloth inside our abdomen? Then my question is, my dear, then what is mesh used in mesh repair? Mesh is a simple piece of synthetic cloth prepared from polypropylene or polyester. It is just like this, just like mosquito net. Mosquito net is prepared from nylon and mesh is prepared from polypropylene and polyester. Naturally, big sheets are manufactured in the factories, and when they come out, they are cut into different types, small or big, and different shapes of the pieces. And this piece of cloth costing just few dollars or few cents is sold in the market in thousands of rupees or hundreds of dollars. So naturally there is a huge profit. So naturally the companies which are manufacturing this product will try to sell their product by hook or crook. So we will not go into details of their marketing strategy, etc. Here I just tell you what is the purpose of stitching this mesh on the hole is to give a perfect strength to the hole. Now tell me, such a delicate net piece can really give you protection to this hole? Impossible. So naturally after operation they will always advise you to follow so many restrictions. Don't climb up the staircase, don't cough, don't travel, don't do this thing, don't do that thing. And practically, in my opinion, you are required to follow these restrictions throughout the life, which is impossible. And suppose you follow also, you can't avoid an attack of sneezing or coughing. You understand? One attack of sneezing, the speed is 160 kilometers per hour. That we don't realize. So naturally, against this force, this mesh doesn't withstand. It tears or the stitches gets avulsed, a hole again reappears and hernia again reappears. In foreign countries like USA or developed countries, for example, they are all using branded mesh, which is very costly. But in underdeveloped countries, they are selling some other brand which is not that highest type qualified or structured, a low quality. Now this high quality mesh for them and low quality mesh for underdeveloped countries is beyond my imagination. But then they are doing this because they want to sell their product. Suppose this mesh is stitched inside your abdomen, what will happen? High quality cloth doesn't shrink. Low quality cloth will shrink. The shrinking itself will cause more hernia formation. So incidence of hernia formation recurrences in underdeveloped countries is almost double. So remember my fifth advice, that never use mesh, or before using mesh in hernia surgery, remember that mesh is a simple piece of cloth. Now, all those surgeons who are advising mesh surgery, they should, I am now telling everywhere during my lectures also and through internet also, social media also, that all the doctors and the hospitals before operating on any patient with mesh should take a separate informed consent from the patient. And suppose if you don't take such a separate informed consent, that mesh is a synthetic cloth and it is associated with so many complications, and suppose that patient develops some complication, he might sue that doctor or the hospital in the court of laws. So such informed consent is necessary to be taken over there. The reason is mesh repair is associated with many complications. The first, I have already told you that the recurrence rate is almost double in underdeveloped countries, whereas in developed countries is almost 10%. But other complications are also there which are associated with foreign body. Mesh is a foreign body. So naturally it is associated with pain, infection, sinus formation, muscular damage, testicular damage, sterility, migration, perforation, rejection, and so many things. So in my opinion, probably 30-40% patients operated with mesh might be suffering with some problem or the other in their lifetime. But the major problem is chronic growing pain. For example, after operation, patient develops pain which is severe. It settles down, becomes slowly less and less and less. But throughout the life you have to carry on with a odd feeling, heavy feeling in the operated area because of mesh over there. For example, you have 2 ears, you don't realize that you have 1 ear. But suppose 1 ear is cut and another artificially is stitched over there. Every moment you will realize that your ear is not normal ear, it's an artificial. Likewise, every now and then you will be aware that that area is not normal. And it doesn't pain much, but heavy feeling, odd feeling still remains lifelong. And if you have any exertion, then it will pain. So remember all those complications of the mesh and then decide whether mesh is to be used for your hernia repair or not. Now the last advice, sixth advice is, we advise that is about the laparoscopic surgery. These laparoscopic companies have come into the market in a big way, like mesh companies also. And they have started giving training to all postgraduate doctors, and they have started societies and they have started giving training, and the training is only for 8 or 15 days and the doctor is given certificate. In my opinion, it is impossible to train any doctor just in 10 to 15 days to operate through laparoscope properly on his patient. So naturally, suppose a doctor attends this, gets certificate, he will purchase laparoscope. That is the profit of that company. And when he comes to the private practice, he will start operating on his patient. Naturally, it's going to be experimentation on the patients. So I strongly oppose such use of laparoscope by improperly trained surgeons. But once that surgeon purchases a laparoscope, naturally he will try to convince his patient how beautiful is laparoscopic surgery. I am going to tell you only other part of this laparoscopic surgery. First is the laparoscopic surgeon has to be extremely expert. If he is not expert, then your life is in threat. Second, general anesthesia is required in laparoscopic surgery. So naturally your heart, lung, brain are involved. So you have to take all dangers of the general anesthesia. Third, air or gas is to be pushed inside the abdomen to bloat it like football under pressure. There are dangers of this also, and all those dangers you have to take. Fourth, while operating there might be trauma to the intestine. And even if there is no trauma to the intestine, you are entering into an untouched cavity. That itself will set up a reaction, and all intestines they get adherent. And if this adhesion takes place, then it's very difficult to cure that patient lifetime. And in spite of taking those dangers, are those laparoscopic surgeons doing any miracle for the patients? No. They stitch mesh only. Instead of stitching it from outside, they stitch it from inside. And triple size mesh is required. So naturally in this operation, all the dangers of laparoscope which just now I told you are involved, and all the dangers associated with the mesh which I have told you before are also there. And in fact these mesh related complications are more serious because mesh is stitched inside the abdomen. If the mesh is stitched outside the abdomen like in open mesh repair and it gets septic, then at least there is no danger to your life. But if stitched inside the abdomen, it gets septic, naturally there is danger to your life. So my sixth advice is never ever get your hernia repair through laparoscope, even if it is done free of cost. But remember, all those things, there are always some exceptions. Then you can always use laparoscope or mesh wherever you want. But it should not be used as a routine in every hernia patient surgery. So naturally last question comes, sir, then what do you do in your operation? My operation is very simple to understand. See, we have told you there are three muscles in front of each other, and behind two muscles they are absent in the lowermost part. That is hernia hole or hernia weak spot. See, this front muscle, which is not affected in hernia, is big enough, bigger. So just in front of the hernia weak spot, this muscle is there. We remove a strip of that muscle without detachment. This is a muscle, simple muscle transfer technique. And we stitch this muscle in front again as before. So the front muscle has become again as before. Plus I got a strong dynamic living muscle strip available for repair of the hernia hole. That I stitch on the hole. Where mesh is stitched, we stitch a muscle strip. And this muscle strip is strong, dynamic, living structure. So the protection in our operation starts on operation table itself. We ask patient to cough on the operation table and show to our assistants, see the protection has already started. So in our operation, there are no restrictions at all. After operation, you want to go to pass urine, go to bathroom. Second day, almost all patients are freely mobile in the ward. All my foreign patients, within 2 to 3 days, they take their sack, laptop, bag, climb up the staircase and travel by aircraft for 20 hours and go easily and comfortably to their country and relax. No question of taking out the stitches also, because we have made such a revolution that we use all absorbable sutures inside. There are no stitches outside the skin also. That is also from inside. So after 8 days you have to just take out the dressing and see whether wound has healed properly. If it is healed properly, continue your normal routine without dressing and without any fear of recurrence in your lifetime. There may be some exceptions for this also. But we advise normal routine work immediately within couple of days as per your tolerance level. But avoid strenuous activities for 6 to 8 weeks. The reason is not fear of recurrence. The reason is pain. Because the wound inside is raw. And it takes 6 to 8 weeks to get it dry. So that it will be no pain wound. And then you can start your all strenuous activities also as per your tolerance level. So there are no restrictions in our operation. Right? Very fast recovery because there is hardly any blood loss in our operation technique. There is no mesh, there is no laparoscope in our operation, so there is no question of complications associated with mesh or laparoscope to be present in our operation. And last, once you are operated by this technique, you are virtually cured for your lifetime. Our world record shows that I have studied and submitted this report in World Hernia Conference also, where it has been shown that there is a 0.2% recurrence rate only and 1.8% complication rate only seen throughout the world. Anything else you would like to ask me?
What about chronic pain after 1 year after the surgery or 2 years after the surgery?
No, there is no question of chronic pain in our case because there is no foreign body.
Okay.
There is no foreign body. There is no question of chronic groin pain in our question. It's a muscle transfer technique, simple. Now, for example, for polios, you operate with muscle transfer technique. Do you get a chronic pain over there? No.
Yeah.
So many patients, burns, for example, they transfer muscle flap. Do they get chronic pain? No. This is also simple muscle transfer technique. There is no question of chronic pain.
Does the muscle get bigger over there when you transfer out the muscle?
No, that strip, which was previously part of the front muscle, becomes now part of the hind muscle. Simple.
So all movements as before.
Absolutely normal. We bring back your anatomy of the inguinal canal back to normal, like a normal individual.
Okay. What about athletes who may be very active, doing things like weightlifting, squatting, bicycling?
We advise to take part in marathon also within a couple of days.
Okay.
Without any fear of recurrence because of strength of the muscles and the technique of repair. But we advise you to restrain yourself from these activities for 8 weeks or 12 weeks as per your tolerance level, and slowly you can go towards your higher exercises or your sports or exercises, whatever is that.
And what about activities like sprinting, stretching? I understand you already mentioned it, doctor, but sprinting?
No problem. You can do normal activities, daily routine, non-strenuous work, like going to office, driving car, climbing up the staircase, squatting, etc. All those things without fear.
Right.
You can do all those things because it is pain-free.
Okay. Thank you so much, doctor.
Thank you.
A lot of questions have been answered.
Thank you.